All right, so hey, I'm here with Jared Kraut today. He's an All-American track guy, but also a pretty avid golfer, right? He's really trying to get his handicap. Yeah, work on the handicap. So Jared's got some problems. He says he feels some. What's wrong? What's going on with your hip?
Just tighten the hip area.
So go ahead and show me your.
Being able to rotate the golf swing, I can't rotate around my hips enough. I feel really tight here. You can see the way that this is in a bad position, not being able to kind of rotate around the spine.
Right. And a lot of pro golfers really need to be able to do that, right? We've got to be able to rotate the spine around a fixed lower extremity. So one thing, if we look at, Jared, if you just go ahead and bring your feet together, and I'm going to take a step back here. Go ahead and just keep your all nice and tight, and we're just going to do what's called a multi-segmental rotation. You're going to rotate to your right. Look at that. Look at how limited he is. We should see that shoulder right, be able to kind of split right between his legs. So if you go to the left, limited as well, right? So he's limited in both. And so what that really is telling us is, could be a couple things, but based on kind of where he's describing it, it looks like he's got some hip tightness, and especially internal rotation, because he's rotating his body over a fixed leg. So Jared, go ahead and show us this. What we've done is we kind of looked at a way to stretch this in some flexion. So essentially what we're trying to do is mobilize, get him improve his internal rotation of his hip in a flexed position. So all he's done, we've gone up on a box. You could do this on the edge of a bed and get your knee up on there. If it bothers your knee, you can always, like he's done, just kind of drop it off to the side. And what we're doing is we've now abducted it, internally rotated it, and flexed it. And then Jared's just providing a glide. What direction, Jared? Just kind of straight down towards the ground?
Yeah, just kind of straight down and rotating back towards the...
And then so now what he's doing is he's got that glide to kind of clear the joint and clear some of that impingement, and then he's rotating to his right over that joint, much as he would during a swing, essentially internally rotating over that fixed lower extremity. So the other thing Jared can do is kind of move in and out. He doesn't have to stay there. He can kind of rotate in. Yeah, pretty nasty. You can't see his nasty pain face there. We're just going to hit this here for a second longer and really rotate that thing over. Now, try to keep your back flat. Don't give in at the spine. Yep, that looks a little bit better. That looks good. Okay. And then, so we've only done this for, what, about 30 seconds. Go ahead and stand back up, Jared. And let's go, let me get in the same spot here. Let's go feet together. And I want you to go ahead and just rotate to the right again. Yeah, so quite a bit better. Now, does that feel like you're able to get in that better position? Or?
Much better.
Okay.
You can go, 10, 15 degrees more before I feel it start to get tight.
Mm-hmm. Now, if you go back to the left, we'll just compare it. Look at that, end range already. So for him, this is very much a joint capsule. Obviously, hip flexibility, those short external rotators can be a limiter, as well as, lumbar spine, all that stuff. But for this, hit this for a couple of minutes until you see change, and this will potentially really get you in a good position for that golf swing, right? So you can drive it 400 yards.
Yeah, exactly.
All right, we'll talk to you later.